So we'll draw the medial view of the pelvis first. Here is the pubic symphysis. Here is the medial border of the pelvis. Here is the auricular process. Here will be the dorsal tubercle of the ilium, where is attached the sacroiliac ligament. Here will be the greater sciatic notch, the ischial spine, the lesser sciatic notch, the ischial tuberosity, and the ischiopubic ramus. Here is the obturator foramen. Here is the pubic crest, the pubic tubercle, the notch for the artery, vein, and nerve, the pectineal eminence, the anterior inferior spine, anterior superior spine, and the iliac crest. Then let us draw the sacrum. Then let us put the sacrotuberous ligament from the sacrum to the ischial tuberosity, and the sacrospinous ligament from the sacrum to the ischial spine. Then let us put the obturator membrane here. Then let us put the inguinal ligament here from the anterior superior spine to the pubic tubercle. It has got a lacunar part like this. It has got a pectineal part, and it has got a part which is called as ligamentum reflexum, which lies medial to the deep inguinal wing of the abdomen. Now, the inferior epigastric artery gives a branch which comes along this inguinal ligament like this, passes through the lateral border of the lacunar ligament, and then goes down the pelvis like this, and anastomosis with the obturator artery. So this artery is called as the abnormal if the obturator artery is absent. Abnormal obturator artery, or accessory if the obturator artery is present. So accessory or abnormal obturator artery. Since when you approach this area of fracture pelvis, you may be able to damage this artery, and it bleeds from both ends, from this end and this end. Therefore, it is also called as corona mortis. That means something that you should be fear of, because it can lead to death. So, we have covered the major ligaments. Now, the inguinal ligament, the lacunar ligament, the pectineal ligament, the ligamentum reflexum, the abnormal obturator artery, the corona mortis, and we have covered the sacrotuberous and the sacrospinous ligaments, and we will place major muscles from the sacrum going out from the greater sciatic notch is the piriformis. We'll color it like this. So this is the piriformis. Then arising out of the surface of the obturator foramen and going out here is the obturator internus, going out of the lesser sciatic notch. Now the structures that pass through the greater sciatic notch are above the piriformis, which is superior gluteal artery, vein and nerve, and below, which which are inferior gluteal artery, vein and nerve. 3 nerves which are sciatic, posterior cutaneous nerve of thigh, and nerve to quadratus femoris. And the pin structures, which is the pudendal nerve, the internal pudendal artery, and nerve to obturator internus. So you have to understand that there is a tendon which extends from the pubic symphysis to the coccyx. From this tendon, there arises a muscle which is horizontal, which goes up to the coccyx, and this muscle is horizontal. We'll color it. And this muscle is called as levator ani. Above the levator ani is the pelvis. Below the levator ani is the perineum. And the perineum has got 2 parts. It has got a triangular part, which is this, through which escape the urine and the vagina. So it is called as urogenital triangle. It is bounded by a membrane which is called as the perineal membrane. The superior fascia of the pelvic pouch and the inferior fascia of the pelvic pouch, which goes into the pelvis. So this is the perineum or the urogenital triangle, and between the 2 sacrotuberous ligament, the rectum pierces the levator ani and goes into the anal canal. So it is also called as the anal triangle. So you have a triangle which is called as the anal triangle. Anal triangle will be bound by the sacrotuberous ligament of both the sides and the posterior margin of the perineal membrane. And here you will have the perineal body. So, what passes through the greater sciatic notch? Above the piriformis, superior gluteal artery, vein and nerve. Below the piriformis, inferior gluteal artery, vein and nerve. 3 nerves: sciatic nerve, posterior cutaneous nerve, thigh nerve to quadratus femoris, and pin structures. Pudendal nerve, internal pudendal artery, nerve to obturator internus. What passes through the lesser sciatic notch? The obturator internus passes out through the lesser sciatic notch. And the pin structures, the pudendal nerve, the internal pudendal artery, and nerve to obturator internus, and nerve to obturator internus. These are the 3 structures that enter through the lesser sciatic notch. So I think we'll cover this much this time, and we'll talk about the false pelvis. That means this part which has the psoas muscle, passing mainly over the pectineal eminence, supported by the iliacus, and on the iliac crest you see the transversus abdominis muscle. In the posterior part, you will see the quadratus lumborum from the inner side. Quadratus lumborum, the three muscles, the transverse abdominis, internal oblique and external oblique, forming the abdominal wall. The iliacus, the psoas, and the artery, vein and nerve. The vein on the medial most side, then you have the artery, and then you have the femoral nerve. We can also tell you that the nerve, lateral cutaneous nerve of thigh, sometimes pierces the inguinal ligament, and therefore it gets entrapped or pressured over here, and that leads to what is called as meralgia paresthetica. So I think we've been able to complete the medial view of pelvis, and we will go on to the posterior and the lateral and the anterior view later.